Palliative and supportive care on Nantucket is a specialized healthcare program. Our mission is to provide the highest quality of care to individuals with life-threatening illness. PASCON services are provided throughout the entire course of someone's illness, from the point of diagnosis onward. We focus on supporting physical, psychological, social, and spiritual well-being with an outstanding interdisciplinary team of professionals.
Hello, I'm Debbie Dolan, the nurse practitioner and PASCON manager. Palliative care is simply specialized care designed for people with serious illness. The goal of this care is to improve the quality of life for both the person as well as for their caregivers and their family members. One of my jobs is to provide symptom management because people with serious illness often have very debilitating and uncomfortable symptoms. I facilitate conversations with patients and their family members. When you have a serious illness, it impacts every aspect of your life. We would like to identify what is important to the patient. What do they need? What do their family members need?
As an island 30 miles out to sea, Nantucket is quite isolated. That also means that we're isolated from certain services. It's really important for residents of Nantucket to be able to receive palliative and supportive care here on island, and for their families to find the support that they need here as well. The expense and time involved in traveling to off-island locations, it just makes it infeasible for a lot of people to access those services off-island. So having PASCON here on Nantucket is incredibly important. There is no one else who is helping with symptom management and comfort and care in the way that PASCON does.
Right before Christmas time, when my sister was away and I was alone with my mother, it felt very heavy because it was a big responsibility and I couldn't do it. I felt like we weren't really doing it right. And having PASCON come in was like a huge boulder was lifted off of my shoulders. And so my mother is not always easy to adjust to new people and new situations, and it's been such a wonderful transition because we've had Libby, who she knows, and Libby knows to touch her. And when anybody touches my mother, she lights up. It's just like, it's amazing. And then we have another volunteer who comes twice a week. She comes right before Mom has to get on the bus to go to the salt marsh for lunch. And she can't remember that it's what day it is. So we always have Leslie come, sit with her for an hour and make sure she gets on the bus. And that gets, allows me to go to work and not always be around the house. Now that we have PASCON in our lives, I feel like we can tackle the next challenge with my mother and take care of her as long as we can.
PASCON's programs and services are funded through the PASCON Foundation. This foundation is an independent, not-for-profit public charity. The PASCON program itself is operated as a department at the Nantucket Cottage Hospital. Through the efforts of the PASCON Foundation, and especially through the support of our members and donors, we are able to provide these services free to the community. This is quite unique, and it's incredibly important because it means that whoever you are, no matter what your health insurance status, we can enable the community members to face life-threatening illness with the confidence that they and their families will be supported and nurtured along the way.
We're so grateful to have this organization in our lives. The staff, I feel lifted up by them and so lucky, so very lucky.